Urinary tract infections are common in adults over 70. Doctors treat them routinely with antibiotics. Patients experience burning during urination, frequent bathroom trips, and cloudy urine. The infection clears within days. But in approximately 20 to 30% of adults over 70, something catastrophic happens that most people never see coming. The urinary tract infection doesn't stay localized to the bladder. Bacteria enter the bloodstream. Within hours, the infection becomes sepsis, a life-threatening condition where your body's response to infection damages your own tissues and organs. Urinary sepsis, also called Urosepsis, kills approximately 25 to 40% of patients who develop it despite aggressive hospital treatment. As emergency medicine physicians who have treated thousands of sepsis cases over 40 years, we see the same tragic pattern repeatedly. Family members bring elderly patients to emergency rooms after they've collapsed, become unresponsive, or developed critically low blood pressure. We ask when symptoms started. The family says the patient seemed fine yesterday, maybe a little off for a few days, but nothing alarming. We run blood tests. The results show severe sepsis. White blood cell counts are critically high or dangerously low. Lactate levels indicating tissue oxygen deprivation are elevated, blood pressure is plummeting, multiple organs are beginning to fail. We start aggressive treatment with intravenous antibiotics, fluids, and vasopressor medications to support blood pressure. But we're fighting a battle that started days ago when subtle warning signs were present but went unrecognized. Research from the Journal of the American Medical Association examined sepsis outcomes in adults over 70. Studies found that every hour of delay in recognizing sepsis and starting treatment increases mortality by 7%. Patients who received antibiotics within 1 hour of sepsis recognition had 80% survival rates. Those who received antibiotics after 6 hours had only 42% survival rates. The problem is that urinary sepsis in adults over 70 presents differently than in younger adults. The classic sepsis symptoms, including high fever, rapid heart rate, and confusion, occur late when organ damage is already severe. Earlier, subtle warning signs appear days before critical deterioration, but are dismissed as normal aging, fatigue, or minor illness. In this video, we'll examine 7 warning signs of urinary sepsis that adults over 70 and their families miss daily. Number 4 appears 48 to 72 hours before critical symptoms, but is almost always attributed to other causes. Number 1 indicates sepsis is already developing, but is frequently ignored until the patient collapses. These aren't vague symptoms. These are specific, recognizable changes that demand immediate medical evaluation. Medical references for every study mentioned appear in the description. Understanding these warning signs literally saves lives. Now, let's examine what to watch when urinary tract infections become deadly. Warning sign number 7, new or worsening confusion and mental status changes. The 7th warning sign of urinary sepsis in adults over 70 is sudden confusion or changes in mental status. This symptom is particularly insidious because it's often dismissed as dementia worsening, medication side effects, or just having a bad day. Here's what actually happens. When bacteria from a urinary tract infection enter the bloodstream, inflammatory molecules called cytokines flood your system. These cytokines cross the blood-brain barrier and directly affect brain function. Additionally, as sepsis progresses, blood pressure drops and oxygen delivery to the brain decreases. The combination causes acute changes in consciousness, attention, and cognitive function. Research from Critical Care Medicine examined sepsis presentation in adults over 70. Studies found that confusion or altered mental status was the presenting symptom in 60 to 70% of elderly sepsis patients. But critically, this confusion appeared 24 to 72 hours before other obvious sepsis symptoms developed. The confusion isn't subtle. Patients who were previously alert and oriented suddenly don't know what day it is. They can't remember conversations from an hour ago. They become disoriented in familiar environments. Some become agitated or combative. Others become abnormally sleepy, difficult to wake, or unresponsive to questions. Family members frequently attribute this to dementia progression, but the key distinguishing factor is acuity. Dementia worsens gradually over months to years. Sepsis-related confusion develops over hours to days. If someone who was cognitively stable yesterday is significantly confused today, this is a medical emergency requiring immediate evaluation. Studies from the Annals of Emergency Medicine found that elderly patients presenting with acute confusion had urinary tract infection as the underlying cause in 40% of cases. Of those with urinary tract infection, approximately 25% had already progressed to sepsis by the time they reached the emergency department. What you must do if confusion appears suddenly is assume sepsis until proven otherwise. Don't wait to see if confusion improves. Don't attribute it to missed medications or poor sleep. Call your doctor immediately or go directly to an emergency room. Time is critical. Emergency physicians will perform blood tests, urine tests, and imaging to identify the infection source and assess sepsis severity. If sepsis is confirmed, treatment begins immediately with broad-spectrum intravenous antibiotics, intravenous fluids to support blood pressure, and close monitoring in an intensive care unit. If needed, warning sign number 6, decreased urine output or dark, concentrated urine. Warning sign number 6 is decreased urine output or noticeably dark, concentrated urine. This symptom indicates that kidneys are being affected by infection in sepsis. Kidneys are among the first organs to fail when sepsis develops. Normal urine output is approximately 800 to 2,000 ml daily, roughly 1 to 2 liters. You should urinate every 3 to 4 hours during waking hours. Each void should produce at least 200 to 300 ml, approximately 1 cup. Urine should be pale yellow to light amber in color. When a urinary tract infection progresses to sepsis, 2 processes reduce urine output. First, blood pressure drops as sepsis causes blood vessels to dilate abnormally. Lower blood pressure means less blood flow through kidneys. Kidneys require adequate blood pressure to filter waste and produce urine. Second, inflammatory cytokines directly damage kidney tubules where urine is produced. Damaged tubules cannot concentrate waste or maintain fluid balance properly. The result is oliguria, defined as urine output below 400 ml in 24 hours or less than 30 ml per hour. Practically, this means urinating only 2 to 3 times daily, producing very small amounts each time. The urine that is produced appears dark brown or tea, colored from concentrated waste products. Research from the American Journal of Kidney Diseases examined acute kidney injury in sepsis patients. Studies found that decreased urine output appeared an average of 36 hours before other obvious sepsis symptoms in elderly patients. Patients who developed oliguria had 3 times higher mortality than those who maintained normal urine output. Family members often miss this warning sign because they don't monitor how often elderly relatives urinate. The patient may not notice or report it, especially if confusion is developing simultaneously. What you must do is pay attention to urination patterns if you suspect a urinary tract infection. If someone normally urinates every few hours, but suddenly goes 6 to 8 hours without urinating, this is concerning. If urine appears dark brown like tea or cola, this indicates significant dehydration or kidney dysfunction. Don't try to treat decreased urine output by forcing fluids at home. In sepsis, the problem isn't simple dehydration. The problem is that kidneys cannot function properly due to infection and low blood pressure. Forcing fluids without medical supervision can cause fluid overload and pulmonary edema, where fluid backs up into lungs. Seek immediate medical evaluation. Emergency physicians will assess kidney function with blood tests measuring creatinine and blood urea nitrogen. They'll place a urinary catheter to monitor urine output precisely. Treatment involves intravenous antibiotics, intravenous fluids given carefully based on blood pressure response, and sometimes vasopressor medications to raise blood pressure, supporting kidney blood flow. Warning sign number 5. Unexplained rapid heart rate above 100 beats per minute at rest. Warning sign number 5 is rapid heart rate, called tachycardia, specifically a heart rate above 100 beats per minute while resting. Normal resting heart rate is 60 to 100 beats per minute. In sepsis, heart rate often increases to 110 to 130 beats per minute or higher even when lying still. The mechanism involves multiple factors. As sepsis develops, blood pressure drops because blood vessels dilate and fluid leaks from blood vessels into surrounding tissues. Your body compensates by increasing heart rate to maintain blood flow to vital organs. Additionally, inflammatory cytokines directly stimulate heart rate. Fever, if present, increases heart rate by approximately 10 beats per minute for each degree Celsius of temperature elevation. Research from intensive care medicine examined vital sign changes preceding sepsis diagnosis. Studies found that heart rate increased above 100 beats per minute, an average of 48 hours before sepsis was clinically recognized in elderly patients. Critically, this tachycardia occurred even when patients had no fever and reported feeling only mildly ill. Many elderly adults take beta blocker medications for blood pressure or heart conditions. Beta blockers prevent heart rate from rising normally. This masks tachycardia, making sepsis harder to recognize. Studies show that sepsis patients on beta blockers have delayed diagnosis and higher mortality because the rapid heart rate warning sign is absent. What you must do is check heart rate if you suspect infection. You can feel the pulse at the wrist or neck. Count beats for 60 seconds. Alternatively, use a pulse oximeter, an inexpensive device that clips on your finger and displays heart rate and oxygen saturation. Pulse oximeters cost $20 to $40 at pharmacies. If resting heart rate is above 100 beats per minute, especially if accompanied by other symptoms including confusion, decreased urination, or feeling unwell, seek medical evaluation immediately. Don't assume rapid heart rate is from anxiety or caffeine. If infection is possible, emergency physicians will assess heart rate alongside other vital signs and lab tests. Tachycardia in the setting of possible infection prompts immediate evaluation for sepsis. Treatment targets the underlying infection while supporting cardiovascular function with fluids and medications if needed. Warning sign number 4 is the most commonly missed because it's nonspecific and easily dismissed. Unusual fatigue, weakness, or a general feeling of being unwell, called malaise, appears 48 to 72 hours before obvious sepsis symptoms in many elderly patients. This isn't normal tiredness from poor sleep or busy days. This is profound exhaustion where getting out of bed feels overwhelming. Muscles feel weak. Simple tasks like dressing or preparing meals require enormous effort. Patients describe feeling like they are coming down with the flu. They want to sleep constantly. They have no appetite. They lose interest in activities they normally enjoy. The mechanism involves cytokines released during infection. Inflammatory molecules, including interleukin-1, interleukin-6, and tumor necrosis factor alpha, cause fatigue, muscle weakness, and malaise as part of the body's sickness behavior response. These cytokines signal the brain to conserve energy for fighting infection. In early sepsis, cytokine levels rise substantially, but other symptoms remain mild. The patient feels terrible but has no obvious fever, no severe pain, no dramatic symptoms explaining the profound fatigue. Family members think the person is depressed, needs more sleep, or is just having an off day. Research from the Journal of Infection examined symptom progression in elderly sepsis patients. Studies found that 70 to 80% of patients experienced significant malaise and fatigue for 2 to 3 days before developing fever, hypotension, or other classic sepsis symptoms. Patients and families described this period as feeling something wasn't right, but not knowing what was wrong. Tragically, most patients don't seek medical care during this window. They stay home resting, assuming they have a minor virus that will resolve. By the time they or their families recognize the severity, sepsis has progressed to dangerous levels. What you must do is take unusual, profound fatigue seriously in adults over 70, especially if there's any possibility of infection. If someone has urinary symptoms, including burning, frequency, or urgency, followed by severe fatigue days later, this pattern suggests a urinary tract infection, potentially progressing to sepsis. Don't wait for fever or confusion to develop. Contact your doctor describing all symptoms. Many physicians will advise coming to the office or emergency room for evaluation rather than waiting. Early evaluation allows in culture, blood tests, and assessment of whether infection is contained or spreading. If sepsis is caught during this early phase, when fatigue is the primary symptom, treatment is much more likely to succeed. Starting antibiotics before blood pressure drops and organs fail improves survival dramatically. Warning sign number 3, nausea, vomiting, or loss of appetite without obvious gastrointestinal cause. Warning sign number 3 is nausea, vomiting, or complete loss of appetite without obvious gastrointestinal cause. Many urinary sepsis patients develop significant nausea and stop eating days before other symptoms become apparent. The mechanism involves multiple factors. Inflammatory cytokines directly affect the hypothalamus and vomiting center in the brain stem, triggering nausea and suppressing appetite. Additionally, as sepsis affects blood flow, the gastrointestinal tract receives less blood and oxygen. The gut becomes dysfunctional, causing nausea and sometimes vomiting or diarrhea. Research from critical care examined gastrointestinal symptoms in sepsis. Studies found that 40 to 50% of elderly sepsis patients reported significant nausea or lost appetite 24 to 48 hours before sepsis was diagnosed. Many stopped eating entirely for 1 to 2 days before developing obvious severe illness. Family members frequently attribute nausea and appetite loss to a stomach virus, food not agreeing with the person, or medication side effects. They offer bland foods and wait for symptoms to resolve. Meanwhile, the underlying sepsis progresses. What makes nausea particularly concerning as a potential sepsis sign is that it compounds other problems. Patients who stop eating and drinking become dehydrated more quickly. Dehydration worsens kidney function and lowers blood pressure, accelerating sepsis progression. Additionally, nausea prevents patients from taking oral antibiotics if prescribed, allowing infection to worsen. What you must do is consider infection and sepsis if nausea appears along with any urinary symptoms or other warning signs mentioned. Don't assume it's a stomach problem without considering infection. Contact your doctor describing all symptoms. If sepsis is suspected, patients require intravenous fluids and antibiotics because they cannot take oral medications or maintain hydration. Emergency treatment addresses infection while providing supportive care for nausea and dehydration. Warning sign number 2, feeling cold, experiencing chills, or having low body temperature below 96 degrees F. Warning sign number 2 surprises most people because they expect sepsis to cause high fever. While fever does occur, approximately 30 to 40% of elderly sepsis patients develop hypothermia, low body temperature below 96 degrees F or 5 degrees C. The mechanism reflects immune system dysfunction. In severe sepsis, inflammatory responses become dysregulated. The hypothalamus, which controls body temperature, receives conflicting signals. Blood vessels dilate abnormally, causing heat loss. Metabolic rate may decrease rather than increase. The result is body temperature dropping below normal despite active infection. Research from the New England Journal of Medicine examined body temperature in sepsis patients. Studies found that elderly patients with hypothermia had significantly higher mortality than those with fever. Hypothermia indicated more severe immune dysfunction and worse prognosis. Patients with hypothermia feel cold despite warm environments. They develop shaking chills that don't respond to blankets. Skin feels cool and clammy to touch. Fingers and toes may appear pale or bluish from poor circulation. Family members often think the person needs warmer clothing or higher thermostat settings. They don't recognize hypothermia as a medical emergency indicating severe sepsis. By the time hypothermia is identified, the patient is often critically ill. What you must do is measure body temperature if someone feels unusually cold with chills, especially if infection is possible. Use a digital thermometer, checking temperature orally or under the arm. If temperature is below 96 degrees F, seek immediate emergency care. Hypothermia in the setting of possible infection indicates severe sepsis requiring intensive treatment. Emergency physicians will start aggressive warming, intravenous antibiotics, and fluids while monitoring for organ dysfunction. Warning sign number 1, rapid breathing above 20 breaths per minute at rest. The number 1 warning sign of urinary sepsis that's most commonly present but least recognized is rapid breathing, called tachypnea. Normal respiratory rate at rest is 12 to 20 breaths per minute. In sepsis, respiratory rate increases to 22 to 30 breaths per minute or higher even when resting quietly. Multiple mechanisms cause tachypnea in sepsis. Lactic acid accumulates in blood as tissues don't receive adequate oxygen. The body tries to eliminate excess acid by breathing faster, blowing off carbon dioxide. Additionally, inflammatory cytokines directly stimulate respiratory centers in the brainstem. As sepsis progresses, lungs may be directly affected, becoming less efficient at oxygen exchange. Research from the American Journal of Respiratory and Critical Care Medicine examined respiratory rate as an early sepsis indicator. Studies found that respiratory rate above 22 breaths per minute was present in 85% of sepsis patients at the time of diagnosis. More importantly, respiratory rate began rising 24 to 72 hours before other sepsis symptoms became obvious. Respiratory rate is the vital sign most commonly overlooked by healthcare providers and families. Blood pressure, heart rate, and temperature are checked routinely. Respiratory rate is rarely counted. Yet, research shows respiratory rate is the most sensitive early warning sign of clinical deterioration. What you must do is count respiratory rate if you suspect infection. Watch the person breathe while they are resting. Count how many times the chest rises in 60 seconds. Normal is 12 to 20 breaths per minute. Above 22 breaths per minute, especially with other concerning symptoms, warrants immediate medical evaluation. Rapid breathing combined with confusion, decreased urination, rapid heart rate, or feeling severely ill indicates possible sepsis requiring emergency treatment. Every hour matters. Delayed treatment increases mortality significantly. These 7 warning signs of urinary sepsis can appear days before obvious critical illness. Confusion, decreased urination, rapid heart rate, profound fatigue, nausea, feeling cold, and rapid breathing all indicate infection is spreading beyond the urinary tract into the bloodstream. The key is recognizing these subtle changes and seeking medical care immediately rather than waiting to see if symptoms improve. Urinary tract infections are common and usually benign, but in adults over 70, any urinary infection can become sepsis within hours. Understanding warning signs saves lives. Which warning signs surprised you most? Have you or loved ones experienced these symptoms? Share your comments. If this information helps recognize sepsis early, please share with others. Subscribe for more life-saving medical content. Thanks for watching.